Chintan, at Deep Breathe, you're creating an artificial intelligence platform that's going to improve the diagnosis of lung abnormalities. What are the elements of the system?
Our simple mission here at Deep Breathe is to revolutionize the way lung ultrasound is done. And the biggest barrier to the democratization of lung ultrasound is the lack of experts available to acquire and interpret these images. So as a logical next step, we figured we'd start creating models that replicate the clinicians or the experts' ability to interpret these images. And so leading from that and developing from a large curated data set we have at our institution, we created models that identify features on the ultrasound image, just like the clinicians do, to then provide a global interpretation of whether it's abnormal, normal, and other conditions such as heart failure, pneumonia, fluid pockets in the lung called pleural effusion, etc. All kind of started with COVID-19, where we created a model and classifier that was able to distinguish COVID-19 on lung ultrasound images where an expert wasn't actually able to differentiate between a pneumonia image or a COVID image, but an AI was able to. And so that led us to think, where could we take this?
Well, it's really interesting to talk about what a clinician's capabilities are, who's skilled and has a lot of experience, versus an artificial intelligence that's always learning, but gains from all of the images it's seen in its data set. How do you compare and contrast the differences between a clinician looking at something and an artificial intelligence expert?
There are so many models that have created now to replicate the function of an expert, right? But a lot of these AI models ultimately lack what we feel is an important piece, which is how the clinician thinks. As humans, a lot of things we create replicate our thinking and our processes, and so similarly, the AI models we're creating, it's a focus that mimics the clinician's approach to diagnosing lung ultrasound. So eventually we envision that this just becomes a natural extension of the clinician, as opposed to something that a clinician has to learn to figure out how it works or what it does.
And the results so far from the data set you built so far to date, how is the outcomes performing versus the clinician alone?
There's a lot of debate in the AI about how to test your models. We've got 3 to 4 clinical experts who interpret the same images, and then we put those images to the AI, and then we see how the AI
sort of
performs.
A control group.
Yeah, in most of our lung findings, the AI model performs greater than 90%, with greater than 90% accuracy, which is incredible, and replicates, and if not surpasses actually, some of the clinicians' interpretation abilities. So it's quite promising and exciting.
So there's a great promise with artificial intelligence that it can enhance the capabilities of clinicians. But on the other side of it, there's a lot of concern in the healthcare industry, but industry in general, that this is going to displace the human role. How do you think Deep Breathe can address this and create a balance?
I think the one belief is that we as clinicians should play a role in the evolution, because the evolution and the adoption of AI is changing and growing rapidly. And so some of the things that I would encourage clinicians to think about, clinicians are sometimes not the early adopters, and some of them can be quite cynical and slow to adopt. So from our experience, what we've learned is, maybe you want to take some time to ask a few questions for yourself. A, what part of your function is this AI replacing? B, is it doing a good job? I.e., what was reported, what did the study show? And then C, assess it for yourself. So if the clinician has the ability to kind of play around and figure out how it integrates into their workflow, then that will allow for the adoption of AI. And as you're doing C and you're assessing it, if you find that it's not working in certain scenarios or in certain complex patients, you bringing that up to the, ideally all these AI models will have robust monitoring in place.
Yeah, and the feedback loops necessary to constantly improve the algos.
Right, so this is where the clinicians will play a role.
From where you are today, Chintan, what are you excited about in terms of the predictive capabilities you can ultimately develop with the AI platform?
I'm excited about a whole range of possibilities, and we can go a lot of different places. We're working with a few strategic partners to develop disease-specific algorithms, so models that can diagnose on spot, for example, pneumothorax, which is air around the lung, in a life-threatening condition, or for example, TB on the field, where you can load your algorithm onto an app on your phone, and then have a handheld ultrasound, and then you can scan anyone in rural settings and then have a diagnosis on hand. And again, these are predictive algorithms that are predicting likelihood of a patient having a disease or not. Other things we also will eventually look for is connecting our very large curated data set. Our data set, thankfully, is 500 times more than the currently available public lung ultrasound data set.
Right, very large.
Yeah, so we've got a significant advantage there, which we hope to link our models to the patient characteristics and their admission specifics to identify and develop hopefully some sort of predictive algorithms that can then play a role in patient outcome, length of stay in the ICU, and other patient important outcomes.